Okay. Hello to all of you out there. Glad you've joined us because you are in for a fascinating conversation to discuss both Graves' disease and thyroid eye disease. Whether you are a thyroid eye disease patient, caregiver, or just plain interested in thyroid eye disease, we will have something for everyone who wants to learn more about these conditions and how the two interact. My name is Carol Bowden, and I'm a thyroid eye disease patient and pharmacist and part of the thyroid eye disease community led by Christine Gustafson. One of my passions is helping others who have thyroid eye disease and educate them in navigating their own personal TED journey and to use the knowledge that they have to make the best decisions for themselves. Our healthcare world is rapidly changing as patients become better informed, oftentimes through the internet. We have many more tools available that we didn't have before. So we can learn more about a variety of topics, especially Graves' disease and thyroid eye disease. Today, I will be speaking with Dr. Margarita Ochoa Maya, who is a board certified endocrinologist, internal medicine physician, a medical executive with experience uniting clinical practice, global drug development, and digital health innovation. She also holds a master's degree in clinical research and executive training in global digital transformation. Currently, she's serving as the chair of the Medical Council for the Thyroid Eye Disease Community and chief medical advisor for Thyroscope. She is deeply committed to advancing precision medicine, integrating AI into continuous human health intelligence, and championing patient led advocacy. So, welcome, Dr. Ochoa Maya. And let's start by talking about the fact that many patients are told they have Graves' disease. And then all of a sudden they begin to notice their eyes are changing. Dr. Margarita, could you tell us what Graves' disease is and how it is connected to TED? And if you can also expand on why these two diseases so often occur together.
Thank you so much for having me today, Carol. It's an absolute privilege to be here with you and to speak directly to our patient community and all the advocates there in our web wire to actually empower themselves and learn more about the disease. You talked to me about, what is Graves' disease and how is Graves' disease and thyroid eye disease, also called TED, connected. So let's dive a little bit into the heart of the confusion. So many patients are told they have Graves' disease. So what is Graves' disease? Graves' disease is one of the diseases that is part of something called an autoimmune thyroid condition. And so, for that reason, we want to talk a little bit about the autoimmune system or the autoimmune diseases. So, the immune system is our own way to defend against foreign organisms. And the word auto, when put before immune, is that our immune system starts recognizing our body as foreign and it attacks one's self. So, in Graves' disease, being part of the autoimmune thyroid diseases, Graves' disease is one in which the autoimmune system attacks the thyroid gland. The thyroid gland is located in the neck, and this immune attack against the thyroid gland is mainly about what's called the TSH receptor, so thyroid stimulating hormone receptor. So the immune attack against this receptor that is on the thyroid gland makes that thyroid gland go on overdrive. So for that reason, we need to understand, what does the thyroid gland do? So usually the thyroid gland causes you to have a lot of energy, right? And so when a person has hyperthyroidism, and that is another version of Graves' disease, that one is specifically because of this autoimmune attack, the person might feel like they have racing heartbeat, they have unusual weight loss, they're sweating. It could be winter and they feel like they don't need a jacket and they're hot all the time. And so what it's really doing is it's speeding up the metabolism. So that is Graves' disease. Now, what happens is 50% of the patients that have Graves' disease, meaning half of the people that have Graves' disease, can have an effect on the eyes. Now, they are like related cousins in a way. So there's a condition that affects the thyroid gland. These immune cells become kind of angry and attack one's self, attacking the thyroid gland. And then by doing that, this attack turns it on, causing that metabolism to rise. That is Graves' disease. Now, when we talk about thyroid eye disease, as the word implies, it's in the eye. So what happens here is that there are two distinct, autoimmune situations. So the immune system in this case attacks the tissues behind the eye. And in this case, the receptor is called the IGF-1 receptor. And so what that does is by attacking this IGF-1 receptor behind the eye, it causes inflammation. It causes those tissues to kind of get angry and bubble up. And so the muscles get inflamed, the fat tissues behind the eye gets inflamed, the tissues around the eye gets inflamed, and then it presents as thyroid eye disease. So they are two distinct diseases that are having one common root, which is the immune system is kind of angry and attacking oneself. And so I hope I answered your question.
Yeah, so that there are really two kinds of receptors. There's some that are in the thyroid, and then there's some behind the eye, but they're different receptors. Is that what you're saying?
Correct.
And it's
Correct.
and these antibodies are attacking, can have the capability to attack both of them. But and so that's why. And so why is it that some people have thyroid eye disease and some people don't?
So again, in that regard, so let's be clear
Yeah,
again. So the
sorry.
immune attack, no, good.
Oh,
The immune attack against the tissue, in this case, one in terms of attacking the TSH receptor, and that would be autoimmune hyperthyroidism, also called Graves, and the immune attack attacking the IGF-1 receptor, which is the one that is behind the eye and causing the thyroid eye disease. These two receptors sometimes are kind of hugging each other and kind of walking around together in the back of the eye. And
I
so
see.
that's why these are kind of together, kind of related. But what it is important by explaining this is that when you treat Graves' disease, it doesn't altogether treat thyroid eye disease, or the other way around. When you treat thyroid eye disease, it's not really fully treating Graves' disease. So there are two distinct mechanisms by which then treatments have actually come about. Now, you said,
Okay.
why is it that only half of people have, thyroid eye
Yeah.
disease? And so
Right.
there are some genetic factors,
Oh,
some environmental factors,
okay.
and some other reasons in which you might be more prone to have both, or the other way around, you might be spared to have one, like the
I
Graves'
see.
disease alone.
I see. Yeah, because sometimes you go, I go into my endocrinologist and she says, "Oh, everything's under control. Your Graves' disease looks great, you're wonderful." But then all of a sudden, but you still have these eye manifestations. And so what you're describing there then really kind of tells us why, because it just doesn't make sense sometimes. Why would, if I have normal numbers, why would my eyes not get better?
Exactly, because again, because they're two distinct diseases. So let's start kind of taking it back a little bit. Graves' disease, that autoimmune hyperthyroidism, is treated with anti-thyroid medication, radioactive iodine, and in some cases, you might have to have the thyroid removed. So let's take the more extreme. The thyroid gland is removed, and when that happens, you might need to take thyroid hormone supplements because now you don't have a thyroid gland. And you might also be medicated to treat the Graves' disease and that hyperthyroidism with antithyroid drugs, or again, like I said, radioactive iodide or surgery. But because there are two distinct diseases and two distinct mechanisms, and for that reason, two distinct autoimmune attacks, you could easily have your thyroid balanced, but still have an attack against your eyes.
I
And
see.
so, again, when we are thinking about what we're doing, one of the things are, the doctor usually treats the thyroid gland and the thyroid disease, but they also need to be aware of the eyes and then realize that there are two distinct treatment pathways.
Yeah. Wow. Isn't our body interesting the way it all kind of works together like that? And then when something goes wrong, of course, that it doesn't, the way it all our body responds. But anyway, I was thinking about how, we're always told that early diagnosis of Graves' disease is the best way to get it managed more appropriately. And I know you've mentioned some of the symptoms of that are typical for thyroid eye disease already, but at what point do you think is a time when the individual, should begin seeking specialty medical care?
Okay, so again, foundationally, when we think of autoimmune thyroid conditions, there's a little bit of a gender predisposition. So females get more thyroid diseases than men, but I'd like to make a point here. When men get it, it can be pretty severe, but
Mm,
it's more common in women. And so when we think of women, we as women have moments in which our hormones are a little bit more activated. So, for example, during pregnancy or right after we deliver, or even during menopause, these are periods in which we might have a lot of hormonal situations. But it's important to identify what is Graves' disease, right? And so if you are feeling like you're losing weight disproportionately, if you're feeling super hungry and despite that you're losing weight, that's not normal, right? You're not intentionally trying to lose weight, and here you are losing weight like nothing, right? Secondly, if you're feeling hot all the time, another one is affecting your heart rate, like you're feeling like your palpitations, you can actually sometimes even hear your heart, you know.
mhm,
And then lastly, of course, you might have a swelling of your thyroid gland. It might actually grow.
mm,
And
mm,
so that is Graves' disease. And for that reason, it's very important that as a patient, we identify something is wrong and we talk to our providers. And again, the community across the board, the scientific community, we work really hard to educate, the providers as well as the patients so that when we come to the doctor, we can say, well, I'm having anxiety, but it's also associated with weight loss, palpitations, and I'm feeling kind of not well. And usually, what the doctor would do is they would order some lab work. And what is the
mm,
lab work? Is called a thyroid stimulating hormone, TSH. They can also order the values of the thyroid hormones themselves, like that we have the thyroid hormone T3 and thyroid hormone T4. And so those would be one of the tests. There are many others in terms of to determine if you're hyperthyroid. Then we go to the root of the problem. We can measure antibodies, thyroid stimulating antibodies that are the ones kind of being the root cause of this Graves' disease. And so that would be the initial workup. But then comes the second part is like the cousin, right? Thyroid eye disease. So since we mentioned that half of the people that have Graves' disease might have a problem with their eyes, we want to make sure that when we go to the doctor, not only do we talk about our thyroid gland and our metabolism and the things that we're feeling, but we also look at things that are happening in our eyes. So what would those be? If you're feeling like constant grittiness or sand in your eyes, or feeling like you really have dry eyes, that might be thyroid eye disease, right? And so if like, oh, wait, I have thyroid disease and then I have this grittiness and this burning in my eyes, well, we want to make sure we tell the doctor about that. But other things that you can actually see, which are signs and symptoms, things that you can feel, is mainly persistent, gritty feeling in those eyes. That's a big one, like feeling sand in your eyes. Unusual redness, like you really have really red eyes and you have no reason. And people might think that did you not sleep? Have you been drinking or things of that nature? Like your eyes are really, really red, puffiness around the eyelids and around the eyes. They're really swollen. And then kind of there's something called the conjunctiva. It feels like a jelly inside your eye, So
mm,
in some situations, again, signs that would be like your eyes look a little off. Now,
mm,
symptoms are more, let's say, you have pain in your eyes, or when you're looking at your computer, your phone, when you're trying to read, when you're actually focusing, it hurts, those eyes hurt. Or if you
mm,
have to look sideways, the eyes hurt,
yeah.
and so pain in the eyes, and specifically even pain behind the eye. Again, if you have an autoimmune thyroid condition, you want to make sure the doctor is aware and recording that in the medical record. Another one is, that staring look. Somebody has that staring look, they look like they're not really focusing. That is something important to notice. Another one is seeing the white on the top of the eye. White on the top of the eye is not normal. So again, a good reason to kind of seek a specialist. And then the other one is you start seeing blurry. Now, this blurry vision can actually evolve into double vision. Now,
Mhm.
what happens here is that you might feel like the floor is wavy or that your balance is off because you can't see very well. These are conditions that you absolutely need to mention to your doctor. And there's one more that is kind of a somewhat of a dangerous one is that if you start having color blindness or you used to
Mhm.
see color and all of a sudden you don't see color, this is a reason to really call your doctor right away. So
Right.
again, and to summarize is we have symptoms and signs or the feelings and things that we can notice for Graves' disease and we have symptoms and signs for thyroid eye disease. Two distinct but kind of cousins go together. And so our main goal here is to make sure that when you see your doctor, you not only talk about your thyroid, but you also call attention to what you're seeing and feeling in your eyes. Did I answer your question?
Yeah, one thing that I wanted to ask, when they talk about eye pain, that has always perplexed me, if you will, because when I think of pain, I think of ouch. But this is, at least in my experience, it's sort of a major discomfort. Could you talk about that a little bit? Because most people think of, when you get hit or, and could talk about what quote eye pain means, maybe.
Okay, that's a really good point that you bring out. So again, I think there's the those everyone feels pain differently.
Hmm.
Okay. And there's a lot, especially like when men get it, we said that less men than women get it, but when they get it, they take a long time to go to the doctor. Pain to me is hard to fully describe, if you haven't felt it, and each one describes it differently. But in this case, it's a dull ache and that feeling of pushing behind the eye, or that all of a sudden I'm going to look sideways and that hurts. Or I'm going
Yeah.
to look the other way and it hurts. And
Okay.
so again, you described one is like when you have something fall inside your eye and it's like a sharp pain. This would be an aching pain that is maybe even constant. And then, as we talked earlier, this is the autoimmune war happening behind the eye, kind of pushing those tissues. And do recall that the eye is inside a bony structure. And so there's really not a lot of space behind the eye. So
Right.
because there's not a lot of space, there's just a lot of pressure. So I think the pain that people might describe is like pressure that feels painful. How about
Okay.
that?
That's really helpful because I was really confused in the beginning of my journey. And, the doctor would say pain in your eye. And I'm like, it doesn't hurt, but it feels uncomfortable. So thanks for clarifying that. So I'm going to move on now to, as we think of thyroid eye disease, that there are many specialists that can be involved. And so, for example, in my situation, I had mostly diplopia, which is double vision. And I have less of the proptosis, which is where the eyes are bulging. And as a result, my healthcare team consists of an endocrinologist. I've got an oculofacial ophthalmologist, a strabismus surgeon. I had an ENT for my thyroidectomy and an optometrist to get my glasses. And then because I had double vision and I was tilting my head back so long, I ended up with a physical therapist because my neck was bad, right? So that was my whole team. How is there a way that you think that we can, as patients or as healthcare professionals, that we can encourage effective communication between all these team members that we have that are trying to address our multiple needs here?
So I absolutely love this question for many reasons. So number one is how one as a patient, in this case, let's say I am a patient too, identifies these things as abnormal. All right. And there is science and epidemiologic studies that say that sometimes it takes up to 5 doctors to really get to the root of the problem. So the first thing is we want to describe this as what's called the disease journey. So it's the progression of the disease and how it gets worse and worse and worse. And that if you don't actually call for help or seek a doctor that would listen to what's going on, it's only going to probably get worse. So the first thing is in terms of how we communicate with our doctor and how we feel what's going on and what's going on over time. So again, one is first identifying these things that we've discussed, then it's talking to your primary care doctor. as usually in the US healthcare system, you would go to your primary care doctor who might say, that seems like it could be a thyroid condition. And so, yes, that's when they go to the endocrinologist. Now, the endocrinologist might say, you're here for the thyroid condition. So, what I do is take care of the Graves' disease. And they would prescribe the anti-thyroid medication. They would then consider the radioactive iodide or the thyroidectomy. Now, what we're also doing is through advocacy and education is helping the endocrinologist go above and beyond the neck and look at the eyes and other tissues as well, because the Graves' disease can also affect the tissues in your feet. So regardless, there's extra thyroidal or outside the thyroid manifestations of Graves, and in this case, thyroid eye disease. So one is thyroid management, and the other one is eye management. So usually the primary care sends you to the endocrinologist. As you are doing this kind of dialogue with the endocrinologist, you might also say, I go to the eye doctor. The other way around, like you said, maybe my double vision was the first thing that manifested. So they might go to the eye doctor first, and the eye doctor by saying, this looks like thyroid eye disease. Have you had your thyroid checked? And you go to the endocrinologist. So this is a very important kind of trifecta here, the primary care, the endocrinologist, and the eye doctor. Now, the eye doctor comes into several, different specialties. So, like you mentioned, there's the optometrist that might look at your glasses. It might be that, now you have a lot of bulging and you might need to have surgery. So, the oculoplastic surgeon. It might be that you're seeing double vision and or color changes and you need a neuro ophthalmologist and so forth. And so, very important to understand that this condition might require, and usually does, not one doctor, but many doctors. So that brings the other specialty that I'm very fascinated by is how we can, communicate better with our doctor so we don't have to wait 5 doctor visits to get the right diagnosis. And the second one is, and again, a plug for the, TED community and the Graves community. We have those storytelling workshops where we can actually express
Mhm.
ourselves and be able to communicate how we are feeling and call attention to these things sooner so that the diseases can be identified and then diagnosed. And then once you make a diagnosis, you have a name for what's going on, then you can get the treatment. But back to kind of even with the patient, it's the empowerment of knowing these labs, it's keeping your file together. And so when you go to the different doctors, a patient can be the source of information. Of course, we have electronic medical records, and we're hoping that everyone communicates. But the bottom line is that this is a multidisciplinary approach. And our goal is that the doctors are all communicating to make sure that the best decisions are made in terms of your treatment based on kind of where you are in your disease journey. Did I answer your
No,
question?
absolutely. And too, like you said, it's nice now that we do have electronic medical records and the fact that, patients do have access to our medical records and are can communicate on, my health or whatever, my chart or whatever you call it, that I can tell you that from experience, I will, like, for example, if I have a surgery, I will email my primary care and my endocrinologist and say, hey, I just had strabismus surgery. I want to keep you in the loop, even though it's in the progress notes, but I'm at 2 different academic centers. And you need to make sure we as patients have to take on that responsibility sometimes because it's not always as smooth of a transition as we would hope it would be. So yeah, so thank you very much. And
I
and I
have one
do
more comment. Oh,
yeah, and I just wanted to make one comment on the fact of the multidisciplinary team. I feel like that's such an important part is to have everybody knowledgeable about all aspects of your care and the fact that I like that physicians are now becoming allowing patients to participate more in their decision making, in clinical decision making, because we each all know our own bodies best, right? And we need to be able, we can be given the information and then decide for ourselves based on the experts who have supported us throughout. And so, Dr. Margarita, I know you had one more comment you wanted to make there.
I did because again, we talked about a journey. So this is not a one, like when we're looking at a movie and you put the movie on pause, those are the times you visit the doctor, but there's a lot of time that goes in between the doctor visits. So when we think of this, we want to make sure that we realize that an autoimmune condition and this kind of war or this situation where our immune cells are kind of attacking us, they go up and down. And
Yeah.
so, number one, the environment that we're in, managing our stress, managing our nutrition with
Mhm.
anti-inflammatory diet, looking at, for example, smoking makes things really bad. And so stopping smoking. And then lastly, over time, because again, the Graves' disease is one condition and the thyroid eye disease is another condition. So these conditions can flare. The Graves' disease can
Yep.
flare and you might need to have your meds adjusted, and your thyroid eye disease can flare. So like we both been talking about, it's really important that the patient like keep a journal, is really tuned in with their little file, and also looks at the labs not only at a one-timer, but over time. So
Yeah.
yes, it's very, very important.
Thank you for making that point. I think that's really super important. So thank you. But I'm going to go and move on from this point. And now that we've kind of covered Graves' disease and thyroid eye disease, we want to talk a little bit about some of the treatments that are available. It seems that this is an ever evolving area. And heck, 5 years ago, we had no medications, and now we have two, and others in the pipeline. Do you want to tell us a little bit more about some of the recent advances in therapy and what we might anticipate? I think a lot of us are anxiously awaiting to see what might be coming down the pipeline.
Well, absolutely. I think we're entering a very exciting time in healthcare, and especially in the innovation of treatments. So we have two major treatments, Tepezza and veligrotug. Well, like I'm kind of having a hard time saying the word, but these two drugs have been pioneers in terms of the way the thyroid eye disease is treated. So yes, so now we have usually what had been done before was steroids, because steroids usually mitigate or help the immune system stop the fire. They stop the fire, but steroids have side effects and also are very generic in the way they're approached. The other one was surgery, right? And then so kind of big surgery where they take kind of the eye out and clean the back of the eye, and then are able
Mm,
to then allow for the eye to be back in the socket. There's radiation therapy, but now we have targeted biologics that will go right to the source of the matter, and that autoimmune situation where the immune cells are attacking the back of the eye. And so these medications are targeted with that. And so first we had Tepezza, and now we have veligrotug. And so in that regard, these two drugs are now out there. One has been established and has been around maybe for 6 years, and the other one just got FDA approval. So what is happening is that we have options, things are available. And so until these two drugs were in the market, really there was nothing much to do
mm,
other
mm.
than surgery. So it's a very exciting time. And
Absolutely.
there are more in the pipeline. There's
Yeah.
more discussions around this. And so there is hope for treatment. And then again, remember the strength of being empowered, being knowledgeable, being on top of how your labs are doing and how you're feeling, digital transformation, allowing to take pictures of your face,
Mhm.
and so things in which you
Wow.
can actually say, this is where I was 6 months ago, this is where I am today. And then let's say you get treatment and they're like, oh, wow, I'm looking like what I did look once before. That
Yeah.
is incredible in terms of giving us hope
Absolutely.
and looking to the future.
Oh, absolutely, absolutely. Thanks for that encouraging remark there. It's so nice to know that there are options today and that there may be more coming down the pipeline. So, and I just have one more question for you. And in just the very short time we have left, if someone was watching this video today and had been diagnosed yesterday with Graves' disease and thyroid eye disease, and oh my gosh, I don't know if you remember your time, but I know when I first was diagnosed, I was like, oh my gosh, what the heck is this? And it's a frightening experience because you've never heard of it. It's a rare disease. you're like, oh boy, nobody else in the world has it. I'm the only one, what would you want them to know?
That's so beautiful. So the first thing is I'd like to thank Christine and the TED community and the Graves community and all of us here supporting it because the number one thing is that you're not alone. Sometimes because this is a rare condition, you might not know anyone else with the disease. And so that feeling of isolation is pretty bad. And again, Graves' disease, the name itself is a little scary.
Yes. Why would you call it that?
There was a
Yeah.
doctor. His last name was Dr. Grave, which again,
Oh,
I think
well,
you
okay.
know Dr. Graves, and so it's an interesting thing. But
Right.
there's a deep, a vibrant, passionate community here together where we are now about empowering ourselves, getting the knowledge that we need as patients, and then being able to communicate with our doctors more effectively. The researchers are avidly looking for new solutions. And then advocates like you, like me, like Christine, and all the ones at the TED community and the Graves community, we're going to be there to support you. Okay. The next one is that this is a phase, like we talked about, a journey. So, although when you first get that diagnosis, and even years ahead, when things come up and there's a flare or some kind, this is a journey where we hold our hands together over the long period. So, although this is a scary phase, with empowerment, with advocacy, with support, getting to the right doctor sooner, like you mentioned earlier, rather than later, by us educating providers in primary care to be able to identify this sooner rather than later, avoiding those complications that come if you were not to treat it. Those are really important things in which we can be advocates and communicate better with our doctors so they don't just, think it's just anxiety or it's just this you've been looking at the screen or TV too long. These are real conditions. And then lastly, there's hope. Now with these new drugs and now a second drug in the market and soon to have many more, there's going to be more options that we can actually have to ensure that we will get better. So this is a message of hope. This is a message of empowerment. And this is an opportunity for us to continue our community together. Thank you, Carol, for having me today.
Oh, thank you, Dr. Margarita. We are so grateful that you were able to spend this time with us today, and we look forward to hopefully seeing you again soon.
Thank you very much.
Thank you.